Hello and welcome to today's video on drugs that act on the cardiovascular system. The cardiovascular system is one of the most important systems in the human body, responsible for delivering oxygen and nutrients to all the organs and tissues. It is composed of heart blood vessels blood. Unfortunately, cardiovascular diseases such as hypertension, coronary artery disease, and heart failure are major causes of morbidity and mortality worldwide. That's why drugs that act on the cardiovascular system play a critical role in the management of these conditions. In this video, we will discuss the different classes of drugs that act on the cardiovascular system, their mechanisms of action, and their therapeutic uses. So, whether you are a healthcare professional, a student, or simply curious about how drugs affect the cardiovascular system, this video is for you. Let's dive in. There are several classes of drugs that act on the cardiovascular system. Some of the most common ones include 1. Diuretics. These drugs increase the excretion of water and salt from the body, which leads to a reduction in blood volume and, in turn, a decrease in blood pressure. Examples include furosemide, hydrochlorothiazide, spironolactone. 2. Beta blockers. These drugs block the action of adrenaline and other stress hormones on the heart and blood vessels, which slows down the heart rate and reduces blood pressure. Examples include metoprolol, propranolol, atenolol. 3. Calcium channel blockers. These drugs block the entry of calcium ions into the cells of the heart and blood vessels, which leads to relaxation of the blood vessels and a decrease in blood pressure. Examples include amlodipine, verapamil, diltiazem. 4. ACE inhibitors. These drugs block the action of an enzyme called angiotensin converting enzyme, ACE, which is involved in the regulation of blood pressure. By blocking this enzyme, ACE inhibitors lead to relaxation of the blood vessels and a decrease in blood pressure. Examples include lisinopril, enalapril, ramipril. 5. Angiotensin receptor blockers, ARBs. These drugs block the action of a hormone called angiotensin II, which is involved in the regulation of blood pressure. By blocking this hormone, ARBs lead to relaxation of the blood vessels and a decrease in blood pressure. Examples include losartan, valsartan, irbesartan. 6. Cardiac glycosides. These drugs increase the force of contraction of the heart, which improves the pumping of blood and can be helpful in the management of heart failure. Examples include digoxin, wabain. There are many other classes of drugs that act on the cardiovascular system, including antiplatelet agents, anticoagulants, vasodilators. The choice of drug depends on the specific condition being treated and the patient's individual characteristics. Mechanism of action of these drugs. Here are the mechanisms of action of the cardiovascular drugs listed. Diuretics. These drugs work by blocking the reabsorption of sodium and chloride in the kidneys, leading to an increased excretion of salt and water, which decreases blood volume and blood pressure. Beta blockers. These drugs work by blocking the action of beta-adrenergic receptors in the heart and blood vessels, which reduces the effects of adrenaline and other stress hormones, slowing down the heart rate and reducing blood pressure. Calcium channel blockers. These drugs work by blocking the entry of calcium ions into the cells of the heart and blood vessels, leading to relaxation of the blood vessels and a decrease in blood pressure. ACE inhibitors. These drugs work by blocking the activity of an enzyme called angiotensin converting enzyme, ACE, which is involved in the production of angiotensin II, a hormone that constricts blood vessels and raises blood pressure. By blocking ACE inhibitors lead to relaxation of the blood vessels and a decrease in blood pressure. Angiotensin receptor blockers, ARBs. These drugs work by blocking the action of angiotensin II, a hormone that constricts blood vessels and raises blood pressure, by binding to specific receptors on the blood vessels and blocking the effects of angiotensin II. Cardiac glycosides. These drugs work by increasing the amount of calcium inside the heart cells, leading to an increase in the force of contraction of the heart, which improves the pumping of blood and can be helpful in the management of heart failure. It is important to note that the mechanism of action of these drugs can be complex and can involve multiple pathways in the body. Thank you. Enjoy some classes. We provide you with valuable and up-to-date knowledge about the pharmacy education. We create entertaining yet informative videos on topics such as chemistry of drugs, biochemical reaction, and much more. Hit that subscribe button and press the bell icon and join our mission to make understanding pharmacy easier for everyone. Like, share, and comment on our videos. We look forward to hearing from you.
Johnson Classes.
The best for best.